So Raja, this has been a very impressive round, and I don't want to add very much, but having done both the health side and the AI side at different stages in my commission career, maybe there are two things I'd like to emphasize coming out of what's been said. The first is that simple steps will determine the speed of our adoption of any innovation, and AI in particular, and COVID is helping. About 10 years ago, when I was at the 10th birthday party of the eHealth Working Group of London's College of Physicians, we said, you know, the thing we're finding difficult is to get doctors to turn the screen to the patients. So that was the problem then. It was a cultural change. And I think what we see in COVID is that a lot of the cultural changes around technology uptake are being pushed hard, including in hospitals and clinics. So I think we have to build on that, but remember always that those simple steps, as Wendy's comments emphasized, will drive uptake and deployment. The second point, which is maybe a bit techier, is to pick up something you said right at the beginning about putting risk in the proper context. Risk is a multi-dimensional space. And the danger I see, if you listen to all the comments made, is that the best is still the enemy of the good. We understand the risks of the status quo and we overstate the risks of the future. For example, yes, maybe AI will make some mistakes in supporting clinical interpretation of radiology, but all the evidence suggests that the mistakes will be fewer, especially in terms of false negatives. And you yourself mentioned doctor-patient interaction and the risks of burnout. In the oncology clinic in the Charité in Berlin, I was hearing in another seminar just a week ago that the use of AI for triage enables the Charité to deal with 5,000 patients instead of 500. And so some of those patients in a week or a day, you know, capacity is increased. Some of those patients are, as Wendy would put it, talking to chatbots. But as a result of talking to a chatbot, they're being slotted in at the right stage in the workflow for the face-to-face interaction. And that's saving time, not just for doctors, but also for patients. And I think those are two interesting examples where, yes, there are risks, and you have to put the risks in the multi-dimensional space. And I think what Ben was saying is, you know, his project Explain sounds really key, because helping us to understand not so much AI literacy, but context literacy, I think is really going to be a big breakthrough for innovation uptake. But the benefits, as I think the Charité example shows, can be really big, because at a time when we're looking at, specifically in cancer, an overhang in diagnosis as a result of COVID, anything that can increase throughput and catch up is going to save lives. So I think the positive benefits in the health space are very clear, but the management of that multidimensional risk culture is still something that as a human community we're going to struggle with. Thanks very much.
Thank you, Robert. Actually, I totally agree with what you have just said about the fact that dealing with the multidimensionality of risk and all the issues is really a human task. For reflecting, and this is also an ethical task, and it's also a policy task, which can be helped by AI systems, by the way, to enable to really measure the impacts. And here also, I mean, we didn't speak about this, but here AI can be very useful to better grasp the what could happen, what would happen if we've taken such or such measures, because it can help simulations, for example. But indeed, the understanding of how the situations can evolve, and the understanding of how priorities and policies should be implemented, this is our responsibility. And thank you for recalling us with this. I think I don't see any questions in the Q&A window. So let me just to Miss Scaly is not with us. I think she had problem connecting. So I would like to turn back maybe to Dawn, because Dawn is on the other side of the Atlantic, and we have been having a very European focused perspective, of course. Maybe Dawn, you could tell us a little bit about some not comparison, but some insights that are proper to the system in the United States, or maybe in Virginia specifically, about the use of AI, and how do you see those aspects?